I am Dr. Subhrangshu Sengupta. I am a senior consultant in Cataract and Refractive Surgery at Center for Sight, Kolkata, AJC Bose Road branch. First, what we all very commonly know nowadays is what we call LASIK. In LASIK, we basically create a flap of the superficial layers of the cornea with the help of a microkeratome or with the help of laser, what we call femto-LASIK. Now, once the flap is created, we raise the flap and then the laser is fired on the stromal bed of the cornea, which reshapes the cornea, and we put the flap back. This, of course, can be done if the corneal curvature and thickness is suitable. The second procedure that I would like to discuss is what we call Contoura Vision. Contoura Vision is a type of customized LASIK treatment which is specific for your cornea. It is basically a type of LASIK, but the laser is fired so that the final vision that you get is more crisp, more clear, and more accurate. Coming to another procedure, what we call PRK or Photorefractive Keratectomy. Here, we do not create a flap, but instead, we basically remove the superficial epithelium of the cornea by various procedures, and then the laser is fired and we put on a bandaged contact lens. However, this procedure is primarily reserved for those who require power correction for relatively low powers. One of the most recent procedures that have been introduced into our armamentarium is SMILE. Herein, we are not creating a flap, but what we are doing is, with the help of a femtosecond laser, we are creating a lenticule in the cornea, and the lenticule thus created is taken out through a small incision. Now, because there is no flap involved, this procedure is more safe for those who are into contact sports, or those who are avid swimmers, or those who would require eye makeup maybe 7-10 days later, or those who might have to use colored contact lenses for various cosmetic purposes. Now coming to the intraocular refractive surgical procedures. I'll be primarily talking about phakic IOLs. Phakic IOLs refer to a group of very thin IOLs that are introduced into the eye and placed above the crystalline lens. There are various factors that need to be studied before we go ahead with the phakic intraocular lens implantation. Primarily, the curvature of the cornea is studied, the specular microscopy values are studied, something called the white to white is studied, and of course, the depth of the anterior chamber of your eye is studied. If all these factors are found suitable, then we can go ahead for phakic IOL implantation. This is definitely a safe procedure, though it is an intraocular procedure and is done in the operation theatre, but the results are very encouraging, and it is particularly preferred for those who have higher ranges of power or in whom the corneal thickness and curvature is such that we cannot go ahead with the superficial corneal procedures.
Follow Center for Sight and post your queries to get answers from the experts.